And British Prime Minister Boris Johnson says the UK needs to prepare for a tidal wave of Omicron cases. Concerns are growing across Europe as a number of countries bring in measures to combat a rise in infections. However, rules in Austria will be relaxed for the fully vaccinated after the country imposed Europe's first full lockdown this winter.
After 3 weeks of lockdown, restrictions for Austria's vaccinated were eased at midnight on Sunday. But protests against the country's plans for mandatory inoculations continued across the weekend. There were also demonstrations in the Czech Republic against compulsory jabs for the over 60s and public servants. France's first closures in months also came into force this weekend, with nightclubs shuttered until at least January. Meanwhile, Russia has passed the milestone of 10 million confirmed infections. COVID passes are required across much of the country, but only 40% of people are currently fully vaccinated. There was little Christmas cheer from UK Prime Minister Boris Johnson, who warned of a tidal wave of Omicron cases.
I'm afraid we're now facing an emergency in our battle with the new variant, Omicron. And we must urgently reinforce our wall of vaccine protection to keep our friends and loved ones safe. Earlier today, the UK's 4 chief medical officers raised the COVID alert level to 4, its second highest level, because of the evidence that Omicron is doubling here in the UK every 2 to 3 days.
With the festive season in full swing, there are concerns across the continent that the COVID Christmas hangover could last well into 2022.
So let's get straight across to London and our correspondent, Charlotte Chelsom-Pill. Charlotte, the UK is seeing a new surge in COVID infections, likely driven by this new variant. Are scientists expecting Omicron to become the dominant variant there soon?
Claire, it was a very somber, stark message from the Prime Minister last night as he outlined the latest data emerging from the almost spread of the Omicron variant in the UK. Now, just to give you some context here, yesterday, over 1,200 cases of the Omicron variant were reported. It is estimated, though, to be considerably higher. That's almost double the amount of cases reported the previous day. So that does tally with what the Prime Minister was saying there, that case numbers are doubling every 2 to 3 days here in the UK at the moment. Now, some of the really stark information in that statement from the Prime Minister was about the efficacy of vaccines. He was really stressing the need for the booster jab and has massively ramped up the UK's booster campaign here to try and fight the spread of this variant. He also warned that even if this variant is found, as more data emerges over the coming weeks, to be less severe, the sheer number of cases that are expected means that the health service here could be overwhelmed. Now, alarming data there emerging surely will set an alarm bell as well for places across the world.
So with that in mind, besides the booster shots you mentioned, what is Prime Minister Johnson and his government's plan for trying to break this wave of COVID infections?
Well, he announced this really ramped up vaccine campaign, booster campaign yesterday evening, and it's really ambitious what the UK and England specifically are trying to do. The Prime Minister said that he wanted in the range of around 1 million booster jabs a day. That far exceeds anything that has been seen so far. Now, in order to do that, they want to have they're deploying military planners to health services to try and really step up the campaign. The question is, though, whether or not this is going to be enough. There are a number of scientists here who say that needs to happen in tandem with more restrictions as well.
DW correspondent Charlotte Chelsom-Pill, thanks so much for bringing us that update from London. And back now to Germany, which is beginning the latest phase in its coronavirus vaccination campaign today. It's for children between the ages of 5 and 11. Parents who want to immunize their young kids can now do so, even though the official recommendation here is specifically for kids with serious pre-existing conditions to get the jab. Now, some other countries have already been vaccinating kids under the age of 12. The United States, for example, started inoculating young children at the beginning of November. And Israel has also been giving under 12s COVID-19 shots for nearly a month. Now, in both countries, over 16% of younger kids have received at least one dose. The vaccine rollout comes after a sharp rise in overall infections in Germany. There's a higher concentration of cases in the eastern part of the country, including kids in this age group. So most don't experience severe COVID-19 symptoms, but they can spread the virus to others. DW reporters visited one German family who say for their children, the rollout can't come soon enough.
Like millions of families in Germany, the Drummonds spent months at home during the pandemic. They're hoping a vaccine for young children will prevent another long stretch at home with the kids out of school.
Well, biggest concern is I think it's one of us getting infected. I think for me that's the biggest one, and then second, endless quarantine.
This situation that we're in, it's not going to go away unless we get everybody vaccinated, and that includes the children.
Germany's Public Health Institute says infection rates among children are higher now than at any other point during the pandemic. The result, many children sporadically in quarantine. That's why 9-year-old Gregory wants to be vaccinated.
I think it's important to me because my best friend's brother, he had corona and he couldn't come back to school for 2 weeks. And I couldn't see him for that long.
Doctors in Germany are already vaccinating children over the age of 12. Now the country's vaccination commission has extended its recommendation to vaccinate children from the age of 5 with pre-existing conditions. But pediatrician Jakob Maske says vaccinating adults should remain a priority.
It's rare that children are seriously affected by COVID-19. Severe cases or deaths are extremely rare. It's a different story among adults. With that in mind, I think we need to vaccinate as many adults as possible to end the pandemic.
Among parents, discussion about COVID-19 vaccines for children has become particularly heated.
I think it's something that parents are very cautious about, and people can get very defensive about as well. So I feel like it has divided the society as well.
Children with pre-existing conditions will initially have priority, but even those without can also get the shot if their parents so wish, and the Drummonds can hardly wait.
The day where we vaccinate our children, we're going to have a big party. And pizza.
So Tanya Brunette joins me now. She is a children's doctor and a spokesperson for the German Association of Pediatricians. A very warm welcome. Thank you so much for coming on to DW News. Shots are going to be going into young children's arms in the coming days. What would you tell a nervous parent? Should they get their kids vaccinated?
If they are that nervous and if they are really anxious about complications from the infection with the coronavirus, they do not have to feel guilty if they decide to get their children vaccinated. But on the other hand, as Jakob Maske already told, the risk of getting a complicated course of the coronavirus infection in this age group is really low. So this is the difficult decision parents have to make these days, yes.
So it's a low risk of complications in children at that age, but Israel and the United States have also been vaccinating young children for weeks now. What can we learn from them about the possible side effects of this jab?
Yeah, their experiences tell us that we have no data of unexpected side effects at the moment. But they haven't collected enough data at the moment regarding the second vaccination. So to be honest, at the moment, we cannot state an absolute answer if we have more side effects with the second vaccination.
Okay, so that data will be forthcoming in the weeks and months ahead, presumably. Now, the new Omicron variant that we've been talking about in this show, that we've been talking about for weeks, it seems to be changing the picture in terms of urgency of government responses to the COVID-19 pandemic. Is that, in your opinion, also increasing the urgency to get young children vaccinated?
I think we don't have enough data about Omicron yet to get a clear answer there. The truth is that we have a lot of infections in this age group, but we have a lot of viruses in healthy children, but they are able to spread, we know that, and this may cause to a decision like that, yes. But at the moment, for a country like Germany, for example, if about 30% of the parents will get their children vaccinated, this may increase the vaccination rate about 3%, and this would not help a lot. So what we really need are more vaccinated adults who are not yet vaccinated and more booster shots.
Okay, so more adults vaccinated, more booster shots. From your personal experience working as a doctor, what do you find that parents are most concerned about when it comes to vaccinating their children?
They are concerned because they still think it is a new vaccination, which is not really the truth, because we have much experience now. We already vaccinated a lot of children older than 12 years. We know about the possible complication for male individuals, especially after the second vaccination. 1 out of 16,000 may suffer from a mild myocarditis. And we have the data from the US and Israel now for the younger children. So at the moment, they don't have to worry really, because we don't have unexpected side effects, and we have a good effect from the vaccination, which is even more effective for younger persons, because they have a really competent immune system. So at the moment, we tell the parents they don't have to be worried about this vaccination.
And just to be clear, this kids' vaccine, it's not the same as the one that the adults are getting, is it?
No, it isn't the same. It's the same contain, but the dosage is lower.
Okay, that was Tanja Burnett, spokesperson for the German Association of Pediatricians. Thank you so much for your time coming on the show.
Thank you.